The topic of healthcare in America is always a point of contention. It is a platform for presidential hopefuls to gain votes in a high stake elections, and it remains to be an unresolved issue that is ever changing in our country. Universal health care is just one small step that can be taken to help resolve some of the issues that we currently see today. We typically only seek medical help when it's necessary and not for preventative reasons. Pre existing conditions hinder people's chances to affordable and quality care. Physicians and insurance companies are profiting off of the sick, and we have been led to believe that universal health care will throw us into a socialized government. As a society, it is our duty to take care of the poor, the sick, the young, and the old if they're unable to do so themselves. So when we think of healthcare in America, we need to start thinking a little bit differently about what it looks like and what it means for the general population. The problem lies within the fact that proper health care is not affordable to many, if at all, and having insurance doesn't necessarily mean that one can afford the actual cost of health coverage. More and more, we're seeing an influx of lower income families using the emergency room for common illnesses that could have otherwise been seen by a primary care doctor. With most insurance plans, wellness visits are free, but if you're unable to afford an insurance plan, there's no other option but to pay out of pocket or to go to the emergency room for something as common as the cold. Um, this not only affects people who can't afford insurance, but it also affects the people who currently have it. Hospitals will write off portions of bills that go unpaid and leads them to spike their prices at the hospital. It's not common for us to seek preventative care um, as it's not affordable. Instead, we wait until there's an issue. A study in an article by the KFF.org on September 2017 states that in 2016, 45% of uninsured adults said that they remained uninsured because the cost of coverage was too high. So oftentimes we're waiting too long until the problem becomes too big, which in turn causes us to spend more money for the health care that we need. Given the resources that America has, no one should be afraid to get sick due to any type of health cost. A common misbelief we see in our current healthcare system is the assumption that having health insurance means that the healthcare is actually affordable, when in reality, many individuals are paying a premium to their company as well as meeting high deductibles and paying off doctors and the ER visits that they have. And another study by ehealthinsurance.com, October 2016, states that premiums for individual coverage average $321 per month, while premiums for family plans average $833 per month. And that's just for the premium. That's your monthly premium. That doesn't take into account the deductible that has to be met before your insurance really kicks in. So what exactly are we paying for? And why is it paying for health insurance still doesn't guarantee affordable health coverage? As of right now, our healthcare is set up on a foundation as a for-profit model. So what this means is being sick pays, and it doesn't pay who you think it's paying. It's going to your doctors. It's going to the insurance companies who are already being paid by you as well as being paid off by the hospitals. So being sick pays, and it pays big, but it pays to the companies that are already making millions of dollars. In a report published by Aetna, it shows that in 2016, medical membership totaled $23.1 million at December 31st, 2016. And that's just one company out of hundreds that people have currently active. When we take an outside look, universal healthcare helps no one other than the general population. So it's no wonder little change wants to be made into regards of the system that we currently have set up. While we sit and wait in the waiting room worrying about if we can afford a procedure or if we can afford a dentist visit, our doctors are raking it in as well as the insurance companies. Health insurance itself, health insurance alone, is a $1 trillion industry per year. And yet we still see a fight for affordable and quality care. We have also been led to believe that universal health care is a result of socialism or socialized medicine, when the two are fundamentally different. And we oftentimes forget that we currently have a intact universal health care plan already set up, Medicare. Medicare allows individuals who qualify to use doctors of their choice within reason. Whereas socialized medicine is government official medical staff that would be taking care of the patients. So we have been taught to believe that universal health care is something that the government would eventually control, when in fact it's just coverage for all. Adequate health care in America has become somewhat of a privilege, and it's not a right. It's a privilege that many are unable to afford. In an article by CNBCS.com, June 2017, average annual cost per person hit $10,345 in 2016. This way of thinking that healthcare is something that few can afford but all need, is unacceptable. Everyone in America should have the same rights and services in the healthcare system. First and foremost, we need to educate ourselves as to what universal healthcare is, as well as the pros and cons of it. We also need to educate ourselves as to where the money is going when we pay our monthly premiums and when we pay our deductibles. We need to change our way of thinking and realize that healthcare across the board is a fundamental right to all United States citizens. Universal healthcare education can start from the government. They can conduct clinical studies for health outcomes in areas that currently provide universal healthcare, as well as comparing our current system with other westernized countries that have a universal healthcare system set up. But a change needs to start at the top. And that means American citizens need encouragement from our government that we all need to help to take care of those who are unable. When you leave today, I want you to really think of our healthcare system. Think of the costs you pay monthly to your insurance plan, on top of what you pay to your healthcare providers. I want you to stop and think of whom universal healthcare would benefit and who it's currently hurting. Think of the babies who are born with pre-existing conditions. Think of the cancer patient trying to afford their treatments. Think of the single mother or the single father who's just trying to provide for their family. I want you to think of your own family when you think of the healthcare system that we have today. We need to adjust our way of thinking because we are America, and no one in our country should go broke due to unpaid medical debts owed to insurance, doctors, and pharmacies. We have to remember that these are our fellow Americans that are suffering and losing hope in the healthcare system. We tell each other, united we stand, but that also means united we fall. If we continue to fail those who need help the most, then we will systematically destroy the foundation on which our country was founded.